Many patients worry about the medications they take every day, especially when it comes to something as important as blood pressure pills. It's natural to wonder if the very drugs meant to protect your health could be causing harm elsewhere in your body. One of the most common concerns is whether blood pressure pills are secretly harming the kidneys, an organ vital for filtering waste and keeping your body in balance. You take your medication faithfully, hoping to protect your heart, brain, and blood vessels. But then you come across stories online or hear rumors from friends that make you question if you're doing the right thing. Suddenly, you're left feeling anxious and unsure. The relationship between blood pressure, the medications used to control it, and kidney health is more complicated than it might seem at first glance. It's not just about lowering numbers, there's a delicate balance at play. Your kidneys are remarkable organs. They filter toxins, regulate fluid and salt levels, and even help control your blood pressure. Because of this, it's understandable to worry about whether blood pressure medications could have side effects that impact kidney function. The internet is full of conflicting information. Some articles warn about potential dangers, while others insist these medications are life-saving. It's easy to feel overwhelmed and confused, not knowing which sources to trust. That's why this video is here, to clear up the confusion and give you the facts. We'll explain how blood pressure medications really affect your kidneys, based on the latest medical research and expert advice. We'll break down the science in simple, easy-to-understand terms. You'll learn why these medications are prescribed, how they work in your body, and what you should watch out for. Our goal is to help you feel confident and informed about your treatment plan. It's important to remember that stopping your medication out of fear can be dangerous. Uncontrolled blood pressure can lead to serious complications, including stroke, heart attack, and yes, even kidney damage. In this video, we'll cover the benefits of blood pressure medications, the potential risks to your kidneys, and the warning signs you should never ignore. We'll also talk about how to monitor your kidney health and when to talk to your doctor. By the end, you'll know how to work closely with your healthcare team to keep your kidneys and the rest of your body safe and healthy. Let's get started on this important journey together. High blood pressure, left untreated, is like running your body's engine at full throttle. It damages artery walls, leading to plaque buildup and narrowing of blood vessels. This makes your heart work harder, increasing the risk of heart failure, heart attack, and stroke. Blood pressure medications break this cycle by lowering the force against artery walls. They relax blood vessels, reduce fluid, or decrease the heart's workload. By controlling blood pressure, these drugs protect your heart, brain, eyes, and kidneys. Taking them is a proactive step for long-term health. The damage from high blood pressure is silent but real. Medication is your shield. Your kidneys and blood pressure are deeply connected. What harms one, harms the other. Kidneys filter waste and balance fluids, but high blood pressure damages their tiny blood vessels. Over time, this can lead to chronic kidney disease or even kidney failure. Damaged kidneys can also raise blood pressure, creating a vicious cycle. When kidneys can't regulate fluids or hormones, blood pressure rises further. This feedback loop accelerates damage to both your heart and kidneys. Breaking the cycle is crucial. Lowering blood pressure protects kidney function. Medications help slow or prevent kidney disease progression. Managing blood pressure is the single most important step to preserve kidney health. That's why your doctor is so focused on your numbers. Doctors choose from several blood pressure drug classes, each affecting your kidneys differently. These medications are crucial in managing hypertension and preventing complications. Understanding how they work can help you appreciate their importance in your treatment plan. Diuretics, or water pills, help your kidneys remove extra salt and water, lowering blood pressure. They are often prescribed as a first-line treatment for hypertension. By reducing the volume of fluid in your blood vessels, diuretics make it easier for your heart to pump blood, which can also reduce the risk of heart failure. ACE inhibitors, like lisinopril, block a hormone that narrows blood vessels, helping them relax. This not only lowers blood pressure, but also reduces the strain on your heart. ACE inhibitors are particularly beneficial for patients with heart disease or those at risk of heart attacks. ARBs, like losartan, block the same hormone's effects in a different way. They prevent the hormone from binding to its receptors, which helps keep blood vessels open. This mechanism is especially useful for patients who cannot tolerate ACE inhibitors due to side effects like a persistent cough. Both ACE inhibitors and ARBs are especially protective for the kidneys, reducing pressure inside their delicate filters. This is crucial for patients with chronic kidney disease. as it helps slow the progression of the disease and maintain kidney function over time. They're often first-choice drugs for people with kidney disease or diabetes. Managing blood pressure effectively in these patients is vital to prevent further complications, such as kidney failure or cardiovascular events. Diuretics are effective for lowering blood pressure, but ACE inhibitors and ARBs offer unique kidney benefits. Combining these medications can provide a comprehensive approach to managing hypertension and protecting your organs. These medications don't just lower blood pressure, they specifically protect kidney function. This dual benefit makes them invaluable in treating patients with multiple health concerns. That's why your doctor may recommend them, even if you feel fine. Preventative care is key in managing chronic conditions and ensuring long-term health. Understanding how they work helps you see their value. By knowing the benefits and mechanisms of these medications, you can be more engaged in your treatment and make informed decisions about your health. While ACE inhibitors and ARBs are commonly prescribed to protect your kidneys and manage blood pressure, there are certain situations where these medications can actually pose risks to your kidney health. It's important to understand these scenarios so you can stay safe and informed. For example, if the main artery supplying blood to your kidney becomes severely narrowed, a condition called renal artery stenosis, taking ACE inhibitors or ARBs can cause a sudden and significant drop in kidney filtration. This can lead to a rapid decline in kidney function, which may require urgent medical attention. Another risky scenario is dehydration. If you're losing fluids from vomiting, diarrhea, excessive sweating, or simply not drinking enough water, your blood volume drops. This means less blood flows to your kidneys, making them more vulnerable to injury, especially if you're taking these medications. Taking ACE inhibitors or ARBs while dehydrated can trigger what's known as acute kidney injury. This is a sudden loss of kidney function that can develop quickly and may be reversible if caught early, but it can be dangerous if ignored. The risk increases even more if you combine these medications with other drugs that affect the kidneys. For instance, using ACE inhibitors or ARBs together with NSAIDs, like ibuprofen or naproxen, and diuretics, which are water pills, can create a triple whammy effect. This combination can drastically reduce kidney function, sometimes leading to serious complications. This is why it's so important to let your healthcare provider know about all the medications you're taking, including over-the-counter pain relievers and supplements. Fortunately, these risky scenarios are relatively rare and can usually be identified by your doctor before they become a problem. Your healthcare team is trained to spot these risks and will take steps to minimize them. For the vast majority of people, the benefits of ACE inhibitors and ARBs far outweigh the risks. These medications are proven to protect your kidneys and heart when used appropriately. To keep you safe, doctors regularly monitor your kidney function with blood tests, especially when you first start these medications or when your dose changes. These tests help catch any problems early, before they become serious. If you become ill, experience vomiting or diarrhea, or start any new medications, it's always a good idea to check in with your doctor or pharmacist. They can advise you on whether to adjust your medication or take extra precautions. Open communication and early detection are key to keeping your kidneys healthy and preventing complications. Remember, never stop or change your medication without first consulting your healthcare provider. Working together with your medical team is the best way to protect your kidneys and your overall health. There's a lot of misinformation about blood pressure meds and kidney health. The biggest myth? That these drugs poison your kidneys. In reality, uncontrolled high blood pressure is the real threat. ACE inhibitors and ARBs are used to prevent, not cause, kidney disease. A small stable rise in creatinine after starting these meds is normal and shows they're working, not harming you. Herbal remedies aren't always safer. Some can harm your kidneys or interact with prescriptions. Don't stop proven medication for unproven alternatives. Feeling fine doesn't mean your blood pressure is controlled. Medication is often the reason you feel well. Stopping suddenly can cause dangerous spikes in blood pressure. Trust science and your healthcare team, not internet myths. Stay informed and ask questions if you're unsure. Early kidney disease is often silent, so regular blood and urine tests are vital. Watch for changes in urination, more frequent trips, foamy or dark urine. Swelling in your legs, ankles, or around your eyes can signal fluid buildup. Persistent fatigue, loss of appetite, nausea, or a metallic taste may appear as kidney function declines. Muscle cramps, brain fog, and itchy skin are other possible signs. These symptoms are subtle and can be caused by many things, not just kidney disease. Don't wait for symptoms. Routine monitoring is key. If you notice new or worsening symptoms, tell your doctor right away. Early action can prevent serious problems. Stay alert, but don't panic. Most issues are caught early with good care. Never stop your blood pressure medication on your own. Stopping suddenly removes your protection, causing blood pressure to rebound, sometimes to dangerous levels. This can trigger a heart attack or stroke. Even if you're worried about side effects, talk to your doctor first. There are many medication options and dose adjustments available. Your doctor is your partner. Don't make changes in secret. Write down your concerns and discuss them openly. Your treatment plan is designed to protect your life. Always seek guidance before making any changes. Protecting your kidneys is an active process. Take your medication as prescribed every day. Consistency prevents dangerous blood pressure swings. Use reminders or pill organizers to help you stay on track. Eat a kidney-friendly diet, less salt, more fresh foods, and stay hydrated. Avoid processed foods and excess sodium. Attend all doctor appointments and complete lab work to monitor kidney function. Tell your doctor about all medications and supplements you take. Be cautious with NSAIDs and ask about safer pain relief options. Combine medication, healthy habits, and regular check-ins for the best protection. With teamwork and vigilance, you can keep your kidneys healthy for years to come.